Janice. I'm so excited to have you here with me.
Thank you so much for inviting me.
We've known each other since grad school, and so I'm glad that you're joining me on Our Africa today. So I'll start with my usual standard question of tell us who you are. It is a simple question, but quite profound in the sense that it establishes you. So tell us about yourself, your family background, and heritage.
Yeah, absolutely. I grew up in rural Manitoba in a small farming community. Although my family weren't farmers, my parents chose to move there for school reasons. We had been living in downtown Winnipeg, and my mom was not too impressed with our options for school. So they moved us out to the country, and I grew up. I mean, we were only 20 minutes from a major city of Winnipeg, but when you're small and have no car, it felt really far from everything. And I had a really amazing childhood of living in this small community. Everything was so safe. You left your doors unlocked at night. I could walk home from my friend's place when I was 12 at late at night, and it was just a really nice environment to grow up in. But neither of my parents were academics. They both worked kind of blue collar jobs. My dad was an electrician. My mom worked in like laundry and housekeeping, so unskilled labor. And from as early as I can remember, my mom always hammered into me that you will go to university and you will get an education, because that was not an option for me. And she really wanted me and my sister to experience those things. So I didn't know what that meant to get a degree. I didn't know about the opportunities that would afford me. I didn't know how to go about it, but I knew that that's what I had to do. So I kind of arbitrarily chose microbiology as a topic to study, because when I was in grade 11 biology, I just thought that bacteria and viruses were so cool, and I decided I would do an undergrad in that. And while I was doing my undergrad, I was paying for my own education. It was very expensive. I mean, it was like $3,800 a year. So it's not very expensive by today's standards. I was actually at this talk at a conference. And this is one reason why I love getting students involved in, all aspects of research programs, because as part of my co-op placement, they allowed us to go to conferences. So I was at this conference that was, multidisciplinary, and I had been, really surrounded by just like virology and immunology and microbiology. And I hadn't been exposed to other disciplines really. And then I went to this conference that was even at our university, and the keynote speaker was he was like the chief public health officer of Minnesota, or so one of the northern states. And he told a story about a hepatitis outbreak in the state, and they traced it back to a green onion farm somewhere in South America. And there were these kids that would play on these farms in the stacks of green onions, and they would slide down the stacks naked. And this is how Hep A contaminated the vegetables that got into the diets of people in northern United States. And I thought, the factors that led to those poor children without clothes playing on green onions that people ate in the northern US was just like unbelievable to me. And I wanted to learn more about that. And that was what really inspired me to do public health. And then I applied to the U of A, not knowing that like public health and epidemiology weren't synonymous terms, because I didn't know that like epidemiology was the basic science of public health essentially. So, but going back to my undergrad, when I had worked in this project and became interested in public health, I really wanted to go to Kenya to learn more about the actual collaboration and the populations that they had been studying. So this research project was aimed to look at, I'm giving like my whole academic history of how I ended up where I am. So
well, that's fine. That's great.
So the whole collaboration was aimed at trying to figure out why a cohort of sex workers in Nairobi was persistently negative for HIV despite frequent exposures. So they were studying natural susceptibility to HIV infection. And they had this cohort of women that had been started in the mid 1980s that they were following, I think multiple times a year through, blood draws and urine tests and surveys. So they had this like really amazing long-term collaboration. And I hadn't traveled anywhere. I had been to like a resort in Mexico once, but I was not a worldly human at all. But I thought, this is a really special thing, and I really want to go learn more about how this whole operation is working. So somehow I convinced them to let me go to Kenya after I finished my degree. And I was able to go I think it was January 2007 to about April 2007 was the 4 months I was originally in Nairobi on this team. And that was really an amazing experience. And I thought that because I had this experience in global health, that I would apply to a global health master's program. And that's what brought me to the University of Alberta. And again, while I was here, I had no money. I moved to a new city. I needed a job. So I was waitressing for a while, but I thought maybe I should get a job that's like related to my degree. So a woman that I have now worked with for almost 14 years, Karen Goodman, had just sent a call out for any grad students interested in working on this new project she was starting. So I ended up getting that job and going to Aklavik in the Northwest Territories for a couple of weeks over the Christmas break that year. And that solidified my interest in doing work in Northern Indigenous communities. And as I said, I'm still kind of a part of that project in some capacity. And I did that work for, a number of years. And then my master's at U of A was focused on supporting a long-term collaboration with researchers in Uganda and a community-driven project there. So I did my master's degree looking at the feasibility of involving traditional healers in expanding coverage of AIDS care programs in rural Uganda.
Why did you decide to go to Africa from rural Manitoba to Africa? What were your first impressions of Africa? That's Kenya, right?
Yeah, absolutely. And Nairobi specifically was the first place I ever really traveled to that wasn't like a resort or within Canada. And I thought a lot about what exactly was it that made me so determined to travel to Kenya and have that experience. And I don't really have a good answer. It was just this sense that I had that, in order to really know this, I had to go do this work in a place that it was, and that the only real way to, I guess, understand these dynamics was to be there. And I'm a curious person, and it was a project that I was involved in, and I think I just wanted the most out of it and to get the most from it. So, and the way to do that was to go to Nairobi and work with the partners there and see the environment there and experience that. And because I hadn't done much traveling, I think I was just itching for an opportunity to do something and to go somewhere. And I was 24 when I first went to Kenya. And my first impression of Nairobi was it was a little intimidating. I was picked up at the airport. I mean, it was easy in a lot of ways because I was going to work with an established collaboration. There was an apartment that I was going to stay at. They sent someone to the airport with like my name on a board. So it wasn't a lot of effort for me, but I get there, it was late at night, and Nairobi is not a safe place. So you're driving around, there are machine guns everywhere. And I didn't know where I was going, and we couldn't get a hold of my colleague that I was staying with. So my first impression was like, okay, I'm in Nairobi now. But then the next day we just, walked the 20 minutes to work, and it's so beautiful. I mean, before you get to know people in Africa, you get to see the land, and it's so stunning and so beautiful. And so that was like, I guess the first impression I have is just, wow, like this place is so, it's just a stunning place to be. And the vegetation is amazing. So that was, my first impression of the city. And it was nice to walk too, that we were somewhere that was walkable. So we never had to deal with commuting in Nairobi traffic, which probably would have started things off with a little bit
of stress. What was it like for you to be a minority in a predominantly Black nation?
It was very uncomfortable because also everyone assumes that you're rich, which as a poor student, I have what I would consider to be like a limited income. But of course, my idea of a limited income is very different than someone living in poverty in Kenya. So I really struggled with how to navigate those situations. So do I bargain with someone selling me something because of my pride, or do I just pay a little extra? Like, I had a friend of mine who, she actually spoke fluent Swahili. So she did a lot of our bargaining when we went out. And at one point she was having this like heated debate about how much to pay for something. I was like, come on, man, you're arguing over less than $1. Like, is this really that important to you? But it turns into sort of a game. And it's one thing that was really, I think, difficult is to not get sucked into the expat community and to not and the politics of that. The politics of that are way worse in Nairobi than other areas that I've been to. So that was one aspect. It's hard to, like, when you're in a major city like Nairobi, it's hard to get into communities that are established and have their own circles. It's the same thing when you move to Edmonton, right? Like when I moved to Edmonton from Winnipeg, people here have their networks. They don't necessarily want to open me up, or like open up to me and bring me into their friend circles. So it's, it's the same thing of people that are living in Nairobi. They have their friends, they have their families. They don't need to entertain some Canadian that's coming in just to have fun for a few months. So it's hard to break into those cliques. Although I made a few friends that I, so many years later, I still keep in touch with in Kenya.
So what was your favorite food while you were there?
Oh my gosh. I'm gonna fail to think of like the actual names for things, but there is this restaurant that was by by the University of Nairobi that did these amazing whole fried fish, and that you'd eat it with, I think it's called ugali, which is the
Ugali, yes,
yeah, which is the corn paste stuff. And I'm remembering things terribly, but yeah. And so after living in Nairobi, I said, like, the goal really is to live in a culture where you can eat foods with your hands and wear sandals all year round.
Exactly.
So I love that aspect of being in Nairobi, is that, and like people, North Americans have such a silly impression of Africans, and like, oh, like, we can go on a mission and teach people how to wash their hands. Like, no, people are pretty up on all of that already. Like, you go to restaurants and they bring the hand washing stuff to your table for you. And I thought that was just, we have such ignorant ideas about what happens in Africa.
In Africa.
They're like, no, we want to make sure you wash your hands. We're going to bring it to your table for you.
Exactly. Yeah. So you know how in every culture there are subtle unspoken rules. What were some subtle unspoken rules you contended with while in Nairobi or even Uganda?
That's a really good question.
Yeah, because I had mine. Like coming from Africa to Canada, there's some unspoken rules that you kind of figure it out on your own, but it takes a while to figure it out before you now learn to fit in to the unspoken subtle rules.
Yeah, I can't think of anything off the top of my head about living in Nairobi. We did learn when we were in rural Uganda that people kind of frowned upon eating while you were walking. So that was something that we didn't know, although I learned about it in kind of a silly way. It was a spoken rule to me, but it was from these two Americans who said that they had this training on like cultural differences before they started their work in Uganda. And they learned that one of those things was not eating while you walk. And they said, and so it made sense to us then why people gave us funny looks. We were eating while walking. I'm like, I think the point of this training was so you didn't do these behaviors, not so that you would understand why people were judging you, things like that. But I mean, Nairobi is not a great example because it's such an international community of people. So I think it sort of develops its own culture of how to behave. Oh, so I mean, one thing that I learned while there within that kind of really terrible dynamic of the expats and everyone who kind of hangs out together, and I mean locals as well who are into hanging out with that community. But if you were a tourist or someone who was there on like a church missions trip, the professionals who were working in Kenya were not interested in hanging out with you. So if you were at a bar and you started chatting with somebody and someone said that they were a tourist, immediately it's like, no, you're not cool. You're not here.
Why is that?
I think that people were so obsessed with themselves and how important they were for being so talented to work in a developing country. And if people were just paying there on their own money to visit because they liked the place, it was seen as not like a cool reason to be in Kenya.
Wow. Wow, so, that's a new one.
Yeah, that was something that I learned. And then in Uganda, I'm trying to think of like unspoken rules. It was, I mean, I think one thing I learned that isn't necessarily an unspoken rule was just a reminder of how diverse places are. So because my only experience outside of Canada had been Nairobi, you kind of get used to thinking, well, maybe Nairobi rules apply here. Mm-hmm. So we might be concerned about walking late at night. But if that's not a problem in rural Uganda, you can walk around. I could walk around alone at night. It was totally fine. So these are things that you kind of pick up as you go. I'm curious about some of your unspoken rules that you...
Oh, I guess for me, Canadians are very polite. Because in my culture, people are kind of, I'm not sure what to use, but right in your face, people will tell you how they feel. But Canadians are very polite. So it took me a while to figure out how to navigate that politeness. If I have a friend who is asking me, do you like this dress I'm wearing? I would tell her exactly how I feel. But I don't think Canadians do that. Exactly. So
No, we don't.
so
Yeah.
that's a subtle. So now I've come to learn how to not do that, how to be diplomatic and try as much as possible to still be truthful. It's very hard for me.
But getting back to one of your first questions about, how it feels to be a minority all of a sudden. I mean, generally for me, it was uncomfortable because I felt guilty. It wasn't uncomfortable because I was being oppressed.
I know.
And I don't know if there's ever a social situation where I did a faux pas that someone would have felt comfortable in calling me out on that. And an example that comes to mind is when I was, working in that lab, I didn't have experience doing these techniques. I was being trained them. And there was another grad student who was helping, I think we are counting cells that day. And he and I both got the wrong number. We both got a very different number. And clearly one of us had screwed up, but he was the one that was retrained, not me. And at that moment, I was like, oh, I've never done this before. It's very possible that I'm the one that's messed this up, but no one's going to tell me that. And maybe it's because I'm the outsider and they just, feel guilty correcting me, or maybe it's the crappy dynamics that are the reality that I'm a white person coming from the rich country. I don't know. But
I know.
that moment made me really aware that no one's going to call me out. And it's so easy to turn into a terrible person in that environment. Like you really have to.
I know. It's a different feeling when you're a minority with power, as opposed to when you flip it and you're a minority here without power.
It's fancy when I go to different countries. Like
Exactly.
you're trying to escape something.
Exactly. It is.
Or it just gets to your head and you think you're better than you really are.
Exactly.
And I definitely met people like that.
Oh, yes, I'm sure. I'm sure. Lots of people like that. Yeah. So I ask this next question in the context of, so back to Canada now, we're back to Canada. In the context of vaccine hesitancy in the Black community. So there appears to be a lack of trust in the Black community towards the healthcare system, and rightly so, when most Black people feel invisible and not heard. You have worked in diverse communities, both Black and Indigenous. So can you share your experiences of how you manage different cultural expectations, including the concepts and elements of building trust across cultures? What is that call for action for all of us, really, as we engage in different communities?
A lot of things to say on that. But I think to start off with, I want to share a story from my fieldwork in Uganda that's relevant to vaccine hesitancy. And, we were trying to interview traditional healers. So, we're based in like a small city, but we were, out on motorbikes every day going to find people in villages. And there were some situations where people like literally ran away when they saw me coming. And there was one time a young woman did that. And I asked like the research assistant I was working with, like, what is going on? And, he spoke to her and she thought I was there to take her kids and vaccinate them because that was what her experience was with white healthcare workers coming and forcing medical interventions on her without her consent. And that was, I think, the first time I experienced more directly the negative influence that, colonization has had on people and the break of that trust and how it negatively impacts. And of course, I experienced that or witnessed that to a huge extent in Canada as well, especially working with Indigenous communities. I think the first step to building trust is one, to understand that that is a very valid perspective that these communities have. Of course they don't trust medical establishments, of course they don't trust the government. That's a very reasonable response to decades and generations of oppression and colonization and abuse and exploitation, etc. There are so many adjectives to describe all the ways in which white institutions have harmed communities of color. So, I mean, the first step is just acknowledging that we have done a lot of harm. And the only way that I've ever, experienced really, and I come from a research perspective, not necessarily a practitioner's perspective, but those, big collaborative projects I've been involved with have really started because of a need that was identified by those communities that are participating. So, I mean, the high rates of HIV were obviously an important factor for those women who enrolled in Nairobi. And H. pylori infection is what we studied in, what we are studying in Northern Canada. And that was identified as a priority for those communities. So if you want to work on vaccine hesitancy, you need to work with those communities and figure out what is the priority in the context of COVID and vaccines, and how do you know, partner on that and not come in and say, well, I have this vaccine that you all need to have. How can I convince you to get it? But it's more like, what are your health priorities? And then working to a space where you come to a common ground of how do we achieve that together? This is one tool that we have. And I don't know much about vaccine hesitancy in immigrant populations. Before I started refining for different communities with low rates, I would say, like, just in general, we could do more outreach. In general, we could be pushing this. We could be getting primary care providers to initiate those conversations.
You're working in your own little way, the blogs you post on Facebook. I like what you're doing with that. I just think that's brilliant. Being able to get out public health messages and in the same vein, using humor. Is it okay if I read one of the ones that I like?
I'm very proud of those, so please read one.
There's one that you said, "Happy Friday, everyone. Have a great weekend. Unless you're planning to ignore public health restrictions. In that case, I hope every traffic light you hit is red, all your web pages load slowly, and somehow you find sand even though you didn't go to the beach." That's someone's day really going bad. So, what made you start that blog? I really love it. And please continue, because one way or the other, you're doing the outreach work.
So I don't have a lot of followers on any social media, but that series of messages, and I've been doing those every Friday for like 4 months now. So despite the fact that I don't have a lot of followers, and as I said, that is the thing that gets me the most attention on Facebook for sure. And I like attention, so that kind of keeps me motivated. Absolutely, I like the fact that people are engaging with that and are laughing at something.
Well, yeah, you're so creative with it.
Well, I mean, if I don't want to take all the credit for it. I don't know if you ever go on Reddit, but there's a subreddit called Ask Reddit where people pose questions and anyone can answer them. And a very common question that gets posed is, what is a minor inconvenience that would ruin your day? But the reason I started that was because I know I have people in my family or people in my friend circle who would turn their nose up at public health restrictions, who don't understand why these are important, who think that COVID is a joke, who feel really put out by the mask requirements, who are vaccine hesitant. And I wanted to be really clear of what my stance was, but I didn't want to be judgy, but I wanted them to know I was judging them. So that's why I picked like the mild inconveniences. And there's been a few times where I've wanted to write like, unless, you're going to lie about getting vaccinated, in that case, like, oh, you know what? I hope you actually do get COVID. I don't actually want anyone to get sick.
Yeah,
right?
I know.
I want people to know, I hope your day goes badly, but I don't want anything bad to happen to you. And I hope that people, one, it gets a lot of likes. So hopefully more people read them and more people see that there's social capital in following public health restrictions.
Exactly.
And I've gotten involved in a small number of like Twitter arguments and Facebook arguments with people throughout the course of the pandemic, and they're exhausting. And they take so much out of you. But generally, my rule is I'm not trying to change the mind of the person I'm arguing with, but I'm trying to show everyone around them that this view they have is not the right one or the only one. And that maybe someone reading that will not take the conspiracy nonsense as a given and will consider other perspectives. So that was kind of my goal with those little public service announcements. And some of my aunts just love them. So I said, you know what? I'm going to keep this tradition going. The pandemic isn't close to over yet, so I'll have lots of COVID fodder for a long time.
So thanks for doing that. I like that. It's non-confrontational, not judging. I have a question for you. It's not really, it might take you a while to try and figure it out, because based on my own experience, it's kind of a hard question. Because so the question is, how do you manage power relationships, especially when you are from the dominant group? with power and privilege and going into marginalized community to help or to work there? How do you ensure that when you're helping, you're not wounding the marginalized in the process? So, from your own personal experiences, how did you handle that?
That is a really good question, and it is a really hard question, and but it's something that I have given a little bit of thought to because, as I mentioned, I'm a person who grew up in rural Manitoba. There was not a single family of color in the town that I lived in. And I will say that, growing up, most people around me were racist, but not towards immigrant communities, mostly towards First Nations. So it was more, those attitudes were more present because there weren't really any immigrants to interact with. People didn't really, it wasn't that they were very tolerant or very accepting or very welcoming. It's just that it wasn't a relationship that happened. So I had my first friends from, other countries when I went to university. So, and that's just to say that I'm not from a place, I didn't grow up in like a diverse urban environment. So I've always wondered, why aren't I like a terrible racist when I have not experienced these things? And part of it, I think, is that even though, like in an African context, I'm a wealthy person. In a Canadian context, I was not. And I went to university, paying my own way, unsure of how I would pay rent sometimes, unsure of how I would pay tuition. When I moved to Edmonton, I had a scholarship that paid for my first year of my master's. I had no idea how I would pay for my second. And there were times where I didn't have money for things. Like I got a fellowship to go to Greece for 2.5 months in the second year of my master's before I did my field work in Uganda. And the university was really behind and paying me for a contract. And I had like one weekend where I had €10 to feed myself for the entire weekend. And so in some ways, at least I understand what a little bit of not having money feels like. And like the stress of poverty, I get that because I've experienced like, do I pay my bills or to keep the creditors off my back, or do I eat okay this weekend? So like I know what that feels like at a very like personal level. But I've also experienced as I'm not poor now. I am certainly like an affluent person who's done well for themselves. And I left my PhD without debt. And I'm so happy that I was able to do that. But, as I was coming from being a clueless rural Manitoban, trying to navigate this academic environment and get opportunities and be resourceful, I was constantly confronted with people who were handed opportunities that were never handed to me. So, as I said, I applied for and competed for jobs in my undergrad that I had to like do interviews, write applications, etc. And then one summer, some guy shows up because he lives next door to the PI in the fancy neighborhood. And I was like, oh, so this is how it is then. I had no idea. Like I was so naive about all the nepotism. And every single research group I've worked in has had, the PI's kids or their kids' friends or their friends' kids or somebody who was just handed an opportunity that was not an option to me because my parents weren't academics and I lived in the country essentially. So I think that knowing that because I've experienced the class divide, I think the racial divide has been something that I had to be shown it. It wasn't something that was obvious to me necessarily. But when you know to look for it and you know what it feels like on the other side of it, I think that it just made me a little bit more sensitive to those things. So I'm really aware of myself and how what I say can be perceived by people. The aspect of entitlement is I think that, and this applies to like Canadian researchers working, like any basically Western country researchers working in lower resource settings. Um, we are so entitled. We are so entitled to science. We think that our worldviews are the only ones that matter. And I think that the biggest lesson I got from my master's was that I had a worldview and that it wasn't the only one. And I think that that has been a lesson that's really carried me through to do other work, in that when I go to other places, I try to be really cognizant of the fact that I'm comfortable with the worldview I have, but I know that it's not the only one. And if we want to improve international collaborations and working in a decolonizing manner in Canada, we need to get over the fact that the way that science is done is the way that we do science is the only way to do it. And we need to be more open to other approaches, to data sharing, to collaborations, to how work gets done. And I think that not being entitled is a huge part of effective collaborations with any kind of diverse group, whether that they're diverse in their geographic location or their income levels or even their discipline. I mean, if you get a bunch of Western scientists together and some are anthropologists and some are, doctors, the anthropologists aren't necessarily the ones who get loudest voices in the room.
Yep.
So, yeah, any kind of collaborative environment, just like don't be entitled to the way you do things.
Now, to take all of this interesting discussion to a logical conclusion, I always end with the self care question. What do you do for self care?
That I think it's a great question to end on. And I tell this to a lot of people that don't necessarily believe me, but I'm inherently a very lazy person. I have a lot of hobbies I like to do, and I don't want to be working all day every day to get things done. Maybe my PhD supervisor would believe you because I'm a very slow writer. But you might have seen pictures on Facebook. I love baking. So whenever I'm stressed and have too much to do, I just need to spend a little time in my kitchen and, make a cake. Even just like kneading bread dough is just the most relaxing thing that you can do. So I really try to give myself a lot of time to bake in my kitchen. And it's also a creative outlet for me because a lot of what I make is art. And I like doing fancy things that I get to use new techniques and things like that. So that I think is a really important thing for me. I've been a bit too busy this summer for baking because now I also have a garden. So I guess the other aspect of self care I do in the summer is gardening. And that's been really, it's so satisfying. Like every day I go out and I pick some greens to make myself like a salad or
Same
a wrap
here.
for lunch.
I do the same. I'm
Oh,
a
that's so
gardener
nice.
too, thanks to my husband.
Oh, good. I will say because I am a really busy person and I have, kind of two contracts, like a postdoc and a contract right now, and I have a lot going on. But I also really love TV and I never have time to sit down and watch a show. So whenever I'm, walking to daycare to get my kid, or if I'm driving on an errand, I always have podcasts on. And people constantly send me these like really intelligent intellectual podcasts. I listen to the Office Ladies and Scrubs and the Good Place podcasts,
Huh.
complete entertainment. So sometimes like I try to maximize my productivity, but sometimes I just need to listen to something that's entertaining. So getting entertainment that I only have to listen to versus like focus on has been a good outlet for me as well.